Hey everyone, it's Dr. Lee here, ready to tackle a new skin condition with you. Today we're diving into the world of Lichen Planus. Now, I know what you're thinking. Lichen, like the stuff on trees? Well, not quite. Lichen Planus is a unique skin condition. It can be itchy and uncomfortable, but don't worry, we're going to break it down together. We'll explore its causes, symptoms, and most importantly, how to treat it. Imagine this. You wake up one morning with an itchy rash. It's not like the usual bug bites. This rash is different. It's got these flat, purplish bumps, and they just won't go away. That, my friends, could be Lichen Planus. Let's learn more. So what exactly is Lichen Planus? It's a bit of a mouthful, but understanding it can really help you manage it better. Think of it as your immune system getting a little confused. Instead of protecting you, it starts to attack your own cells. It starts attacking the cells in your skin and mucous membranes, which are the moist linings inside your mouth, nose, and other areas. This causes inflammation and those telltale itchy bumps. These bumps can be incredibly uncomfortable and can appear almost anywhere on your body. Now here's where it gets interesting. Lichen Planus has some very distinct features that can help in identifying it. Lichen Planus is all about the 6 Ps. These 6 characteristics are what make this condition unique and recognizable. These are the key characteristics of this tricky rash. Each one helps to paint a clearer picture of what you're dealing with. Planar. The bumps are flat-topped, like tiny plateaus on your skin. This flatness is one of the first things doctors look for. Purple. The rash often has a purplish hue, although it can vary in color. This purplish tint is another hallmark of Lichen Planus. Polygonal. The bumps can have angular shapes like little polygons. These shapes can sometimes make the rash look almost geometric. Pruritic. Oh boy, is it itchy. This is a big clue for Lichen Planus. The itchiness can be intense and persistent, making it hard to ignore. Papules. These are the small raised bumps that characterize the rash. They can be numerous and spread out over large areas of the skin, possible Wickham's striae. These are fine white lines that might appear on the bumps like tiny stretch marks. These lines can be a telltale sign and are often seen under a magnifying glass. Understanding these 6 Ps can help you and your healthcare provider identify and manage Lichen Planus more effectively. It's all about recognizing the signs and knowing what to look for. Treatment often involves managing the symptoms, such as reducing inflammation and controlling the itch. Your doctor might prescribe topical creams, oral medications, or other therapies to help manage the condition. With the right treatment plan, many people find relief from the symptoms of Lichen Planus. It's important to follow your doctor's advice and keep up with any prescribed treatments. Remember, while Lichen Planus can be challenging, understanding it and working closely with your healthcare provider can make a big difference in managing the condition and improving your quality of life. Lichen Planus can affect anyone, but it's more common in adults between 30 and 60 years old. And guess what? It seems to affect women slightly more than men. The exact cause of this mysterious rash is still a bit of a head-scratcher for doctors. But we have some clues. Seems like Lichen Planus might be triggered by viral infections. Could it be a virus throwing your immune system out of whack? Possibly. Medications? Some medications might trigger an immune response that leads to Lichen Planus. Stress. Stress. The culprit behind so many health woes? It could definitely play a role. Genetics. If it runs in the family, you might be more susceptible. Now let's put on our lab coats and take a peek under the microscope. When we look at Lichen Planus tissue, we see a battlefield. Your immune system's T cells, those brave little soldiers, are attacking the cells in your skin and mucous membranes. This attack causes inflammation and destruction, leading to those characteristic bumps and plaques. We also see something called band-like infiltration, which is a fancy way of saying that the T cells are lined up in a row, ready for action. It's like a scene straight out of a medical thriller. Section 5, Lichen Planus in action, a rash of appearances. Lichen Planus is a master of disguise. It can show up in so many different ways. The most common type is cutaneous lichen planus, which affects the skin. You might see those classic purplish bumps on your wrists, ankles, lower back, or genitals, but wait, there's more. Lichen planus can also affect your mouth, known as oral lichen planus. This can cause white, lacy patches or painful sores. Your nails, referred to as nail lichen planus, might become ridged, thinned, or even detached. And finally, your scalp, known as lichen planopilaris, which can lead to hair loss and scalp inflammation. Section 6. Cracking the code diagnosis and detective work. Diagnosing lichen planus is like solving a medical mystery. Your doctor will start by asking about your medical history and symptoms. Then they'll examine your skin and maybe even take a small biopsy. This biopsy is like a puzzle piece that helps us see the bigger picture. By looking at it under a microscope, we can confirm the diagnosis and rule out other conditions. Sometimes we might use special lights or tests to get a closer look at your skin and make sure we're on the right track. Section 7, fighting back, treatment and triumph. Now for the good news, while there's no cure for lichen planus, we have plenty of ways to manage it and ease your symptoms. Our goal is to calm the inflammation and give your skin a break. Here are some of our trusty weapons. Topical corticosteroids. These powerful creams and ointments can help reduce itching and inflammation. Antihistamines. Remember those itchy bumps? Antihistamines can help tame the itch. Phototherapy. Sometimes exposing your skin to controlled amounts of ultraviolet light can help clear up the rash. Oral medications. In more severe cases, we might prescribe oral medications to suppress your immune system and calm things down. Section 8. Looking ahead, prognosis and prevention. Most of the time, lichen planus goes away on its own within a year or two. This self-limiting nature of the condition can be a relief for many patients, as it means that the body often has the ability to heal itself without the need for extensive medical intervention. But it can be a bit of a roller coaster ride, with periods of flares and remissions. These flare-ups can be unpredictable and sometimes frustrating, as the symptoms can vary in intensity and duration. It's important to stay patient and maintain a positive outlook during these times. The good news is that it usually doesn't cause any long-term damage to your skin. This means that once the condition resolves, your skin can return to its normal state, free from the lesions and discomfort that lichen planus can cause. However, some people might experience post-inflammatory hyperpigmentation. This is a condition where the affected skin becomes darker, even after the rash clears up. This hyperpigmentation can be a cosmetic concern for many, but there are treatments available that can help lighten these darkened areas over time. This means that the affected skin might become darker even after the rash clears up. It's important to consult with a dermatologist to explore options for managing and treating hyperpigmentation effectively. Scarring. In rare cases, lichen planus can leave behind scars. These scars can be a reminder of the condition long after it has resolved, but there are various treatments available that can help reduce the appearance of scars and improve the overall texture of the skin. While we can't always prevent lichen planus, there are some things you can do to reduce your risk. Taking proactive steps in your daily life can make a significant difference in managing the condition and preventing flare-ups. Manage stress, easier said than done, right? But finding healthy ways to cope with stress can do wonders for your overall health, including your skin. Techniques such as yoga, meditation, and deep breathing exercises can help you stay calm and reduce the likelihood of stress-induced flare-ups. But finding healthy ways to cope with stress can do wonders for your overall health, including your skin. Engaging in regular physical activity, pursuing hobbies, and maintaining a balanced lifestyle can all contribute to better skin health and overall well-being. Avoid triggers. If you know certain medications or other factors trigger your lichen planus, try to avoid them. Keeping a journal to track your symptoms and potential triggers can be helpful in identifying and avoiding these factors. Working closely with your healthcare provider can also help you develop a personalized plan to manage and prevent flare-ups. Section 9. A message of hope. You're not alone. Living with lichen planus can be challenging, but remember, you're not alone. This condition affects many people, and it's important to know that support is available. Millions of people around the world are dealing with this condition, and there's hope for effective management and relief. Whether you're newly diagnosed or have been managing it for years, there are resources and communities ready to help. If you think you might have Lichen Planus, don't hesitate to reach out to your doctor or a dermatologist. Early diagnosis and treatment can make a significant difference in managing symptoms and improving your quality of life. We're here to help you navigate this journey and find the best treatment plan for you. Remember, knowledge is power. Understanding your condition and the available treatments can empower you to take control of your health. The more you know about Lichen Planus, the better equipped you'll be to manage it and live your life to the fullest. Educate yourself through reliable sources, ask questions, and stay informed about new developments in treatment. And hey, stay tuned for more skin-tastic adventures with Dr. Lee. Our journey into the world of dermatology is just beginning, and there's so much more to discover. We'll continue to explore the fascinating world of dermatology together. From understanding common skin conditions to discovering the latest in skincare innovations, we're here to provide you with valuable insights and support. Until next time, take care of your skin and stay healthy.